I'm just keeping it real. You look like the sore loser in the equation. You look like the sore loser. So you need to be careful and spell it out. Here's what's going to happen. Okay. If we see a decrease in federal funding for EMTs, you're gonna have a reduction in services. It's just that. Welcome in with your Wakanda RN. What's going on, ladies and gentlemen? We're here with a special episode today. I am solo dolo. It's just me. For your wrestling fan, I would say it's just me, Uso. It's just me. Shout out to Jey Uso. So, ladies and gentlemen, it's just me. But we have a lot to talk about today. I'm very excited. Very excited. We got a lot to talk about. So let's go ahead and get into it, man. Let's go ahead and get into it. So my first topic today is EMTs. EMTs. So for some of you who may not know, if you pay attention to the news, so there's a bill, I believe it's bill, it's 1067, bill 1067. And it has a lot to do with funding, man. A lot to do with funding with EMTs. A lot to do with funding EMTs. Okay, so what this bill is basically reducing funding for EMTs. Okay, so my EMT friends, or for those of you who may not be aware, EMTs do not get paid very well. They don't get paid very well at all. It's actually pretty sad, pretty pathetic, because you can work at Burger King, McDonald's in certain places and get paid more as a worker. No disrespect to my McDonald's workers or no disrespect to anybody who's in that career field. However, compared to what they have to do, it is quite sad. We need EMTs. I know I saw something recently about how there's some places that can't even send an EMT and a paramedic. They have to send 2 EMTs because there's a lack of paramedics in the field right now, which is scary. Paramedics are able to do more. They have more experience. You have more knowledge, more schooling, so they're able to do more. So you would want a paramedic to be there on the scene whenever you have a serious car accident or whatever emergency is out there. You want the people with the best knowledge and best experience out there. So if I remember correctly, in 2020, they received a large increase in funding, due to COVID and everything. They received a large increase in funding. And so you had a larger increase in EMTs nationwide. But you go literally a year later, those numbers are drastically decreased from 2020 to 2021. And even going from 2021 and where we are today, those numbers we haven't seen drastically increase in those numbers. And literally it's because it comes down to money. It comes down to money. Now, I'm not going to sit and pretend like I know how every EMT state by state is funded, but I know down here in the South, it's a combination of reimbursement, insurance reimbursement, plus funding, federal funding. So here's what's going to happen. I'm going to go ahead and spell it out. Here's what's going to happen. Okay. If we see a decrease in federal funding for EMTs, you're going to have a reduction in services. It's just that simple. And that is the last thing we need right now. We need EMTs in the field. So we don't need less. We need a lot more, right? But they need to be paid accordingly, right? Who wants to be in a situation to where you cannot get the help that you desperately need because there's no longer funding? So, instead of one county, maybe there's emergency medical services in one county, but let's say they get shut down. So you may have to go 2 counties over, right? And we know that in terms of life or death, we're talking about seconds, minutes, right? So you're going to see people that are going to be suffering and getting delay of care and lives potentially lost because of a decrease in funding. And we can't have that. We have to have that funding for EMTs. Okay. So if you want to help, you want to donate, you want to see what you can do, Call your local EMT station and they can give you more directions and more help on what to do to help them out, because we absolutely need them. So I'm trying to just bring awareness, because people may not know. I mean, they can tell you all the logistics. They can give you the numbers of why everything is what it is. They can talk about the insurance reimbursement. They can tell you all that. They can tell you all that. Okay. There is a couple things though, my EMT friends. I mean, I wanted to give y'all the positive. I wanted to give y'all the resources. You know, I wanted to bring awareness, right? But there is something else I did want to address. There is something else I wanted to address. And it's not all y'all. It's just a few of y'all, but I got to address it because I've seen it recently, right? So in my quest to find more information on all of this stuff, the funding with EMTs, I happen to come across something, right, about individuals who call emergency medical services who just use it as a joyride, right? And so there's individuals who don't know what an emergency is, don't know what constitute an actual ambulance ride is, which that's a whole nother subject. So if you listen to this, do not call the ambulance unless it is an absolute emergency. Okay. You know what I'm saying? If you feel like you're having a heart attack, call 911, get EMS there. Stroke-like symptoms, call. Lost a limb, call. All right. There's certain things you can call for, but I kid you not, right? There's people who have called emergency medical services for menstrual cramps. There's people that have called emergency medical services literally because they're just having knee pain. I've seen it. I'm not making this up. I've seen it. Don't call emergency medical services for just random knee pain. All right. Go see your primary care provider. Very important. Go see your primary care provider. That's just the tip of the iceberg. Okay. So we'll just get that out the way. So I do agree with y'all that there's a lot of people who call emergency medical services for absurd things and they don't need to. So I completely agree with you there. But there was one gentleman, I don't know if he was EMT, paramedic, I don't know what his role was, that he decided to attack nursing homes. Now, somebody who came from long-term care, I'm going to have to speak on this. I know, guys, listen to me, my EMT friends, my paramedic friends. I know it's not the sexiest thing. I know it's not the most appealing thing to go to a nursing home, but it is absolutely needed. And I understand some of y'all are disappointed because it's not the most exciting thing. It doesn't give you that adrenaline rush having to go to long-term care facilities. But we need y'all to go to long-term care facilities. And here's a big no-no. If you're listening to this, your EMT, please listen to me very carefully. Do not talk patients out of going to the hospital. Please do not do that. Please do not do that. People who are in long-term care are properly trained, educated, know the patient. Just because you don't see signs and symptoms of whatever that you want to see doesn't mean that you need to have the right to talk these patients out of going to the hospital. No, I'm not making this up. I've seen it happen. I need you guys to literally take them to the hospital so they can get treatment and so they can come back. Okay. It's not a waste of services. It's not a waste of services for them to go to the emergency department, depending on what it is. Because if you guys have never sat down and talked to people in long-term care, then you don't understand. You don't understand. You know, some of you would say, well, can't they wait till tomorrow? Or they can't do can they not just do the labs there or whatever? You know, if somebody's having, and let's say somebody drew labs earlier that day, right? But then they have a critical lab value and we call the provider and that provider wants them sent to the emergency department to have more further testing done, something that cannot wait. Well, we're just doing what we're told, right? And so they need to be sent to the hospital and they need to be evaluated. I don't know how many times that somebody's tried to talk somebody out of going to the hospital and they're admitted for sepsis or whatever the case may be. They are admitted. Okay. So please, my EMT, paramedic friends, please stop doing that. Please stop doing that because there's complexities when it comes to these geriatric patients, and you guys do not have the proper expertise. You guys don't have it. And that's okay. Just like people working long-term care don't have the expertise that you guys when it comes to emergency situations. Okay, that's fine. We all have different abilities. We all specialize in different areas. So please, we respect what you guys do, but you guys need to give that proper respect back to us. Okay, I just had to get that off my chest. Okay, I want you guys to give us the proper respect for those who work in long-term care. That's all I got to say about that. Okay, I'm sure some of you guys may have something to say in the comments below. Now, on to a few other topics. So back on the healthcare side here. Now, you're going to see weird things like this that's going to pop up occasionally. So I'm going to go ahead and read this to you guys here. So there was the quick version is somebody was reusing needleless syringes at a hospital. Now, why on earth would somebody use needleless syringes to try to save the hospital a buck or whatever the case may be is absurd. It is absolutely absurd. So we have a cheapskate regional healthcare is contacting patients who may be exposed to bloodborne pathogens after a now former nurse at Cheapskate Regional Medical Center reused needleless syringes to administer IV medications over a period of 18 months. That's way too long. The nurse worked in the post-anesthesia care unit between July 24, 2023 and January 20th, 2025. The hospital has since terminated the employee and launched a wide-reaching effort to warn and support potentially affected patients. So pretty absurd, right? Really and truly, guys, I mean, this is pretty lazy to me because, you know, I'm really sitting there trying to really think about it. I mean, I've seen people really try to save the hospital a buck. I have. I've seen people literally try to do everything in their power, to try to save money. But I've also seen nurses who are flat out lazy, you know, who won't follow infection control protocols and they want to reuse things. It's nasty. Okay. So, you know, of course, this headline may have been more alarming if people say it was needles, right? Because you think of things like HIV, AIDS, but potentially reusing needleless syringes, can you pass on pathogens that can affect you? It is possible. The risks are very low, but it still can happen. And it's weird. So here's the statement from the Cheapskate Regional Healthcare. They said, "We deeply regret this incident occurred and are taking every necessary step to support these affected and to prevent any reoccurrence. The the employee acted in violation of training, hospital policy, and regulatory standards and no longer works at our hospital. The patients who receive care from a former nurse during the affected time frame have been contacted by the hospital and are eligible for free bloodborne pathogen testing." So I know the hospital is upset because they're losing money in this process. I know they're upset. It's not even so much about the patients at this point. For them, it's about all the testing that they're having to do to these patients. I mean, we're talking about from 2023 to 2025, right? So, yeah. So there's no telling how many patients that got exposed and they're having to do all this testing that they're losing thousands upon thousands of dollars for. So, I mean, we could pretend like it's about the patients, but it's not about the patients. It's about the bottom dollar. So let's just get that out the way. Absurd. It is absurd. So if you're in healthcare, and I don't know if you do this or not, but if you do, please do not reuse needles. What are we doing? Please do not reuse needles. All right. Let's get that out the way. Protect yourself, protect your patients. I mean, because guys, you violate patient trust when you do this. Whenever we see articles like this, it's a violation of patient trust. You're going to have the public that becomes less and less trusting of nurses. Okay? And we need the trust of the general public. We do. So let's get that out the way. Let's not do that again. Okay? Okay. So, oh my goodness. Listen. I know in 2025, I've seen something about the man versus one man, or well, one gorilla versus 100 men. I think 2024 we had the bear versus man. I mean, we're gonna have topics about man versus women. Man versus women versus animals seems like for a long time. But there is something I did want to see. I saw it recently, so I'm gonna have to just talk about this, address this to some extent. So recently, I saw where a female that this I guess she was in contact with a famous nursing content creator. Like they had back and forth, they were chatting, flirty. They were, what I'm saying, they were on their way to becoming potentially romantically involved. Well, according to this young lady, that this particular nursing content creator, which he hasn't said anything. The content creator in question was Nurse Mikhail. Some of you listening may know who this is. Some of you probably have no idea. Big following on TikTok for sure. Big following on TikTok. Accused this gentleman of love bombing and accused the gentleman of just ghosting her. Right? So, if you don't know what love bombing is, you know what I'm saying? You're beautiful, you're great, you're wonderful, you know what I'm saying? I like you, I love you, I want to be with you, you're this, you're that. And then, they pull away. So unfortunately, I hear this a lot. I hear this a lot with guys, right? And so obviously, if this happened, her feelings were hurt, and she wanted women to be aware of his behavior. Okay. Now, I kept listening and looking for a potential crime. It's like, okay, is there slander? Is there defamation? Is there, like what? I kept looking like, okay, what did he do that was so wrong? And before any of you really kind of form an opinion, what I'm trying to get at is, okay, what is the one thing that women need to be aware of to keep away from this gentleman? I didn't see anything other than the love bombing. The love bombing and pulling away. Is that nice to do to someone? No. No, it's not nice to love somebody and then pull away. But really, him pulling away, sis, if you're ever listening or watching this, it's probably the best thing for you. If this occurred, I'm just speaking on what it's. I mean, he hasn't said anything. He may not say anything. I don't know. Everybody has their own opinion. But you may have saved you some heartache because in terms of love bombing, a lot of manipulators, narcissists, they start out like that. I'm not saying that's what he is, but I'm just saying. And then, they can use that to manipulate. So he may have saved you some troubles, may have saved you some heartache with that. So that's first and foremost. Now, if nothing really occurred, I feel like this is kind of something that could have just been said nothing about. Like, you tried, or both of y'all tried and just didn't work out. Happens all the time. Happens all the time. But here's the thing too. I'm trying to look at it on both ends here, because if he did that and he pulled away, it's not a good look for him. But you're accusing him of love bombing and pulling away, that's not a good look for you either. You keep saying, I want people to be aware. I want people to be aware. All I'm aware is right now is, okay, well, potentially maybe he's doing that. But at the same time, I'm like, okay, well, you're potentially going to turn people away from you, because it looks as though on the surface that he gave you attention and you wanted more, and he left, and now you're exposing him publicly because you didn't get the attention that you wanted. It's not a good look for either or, unless he committed a legit type of crime. If he committed a crime, he committed some type of act, that deserve that type of awareness, then that's another story. But right now, I'm just keeping it real. You look like the sore loser in the equation. You look like the sore loser. So you need to be careful. Ladies, men, we need to be careful. Be careful. Because right now, and maybe I bring somebody on to talk about this in a deeper subject, but right now, there's just such a disconnect between men and women that I don't know. I feel like we're going to have another, woman and a bear. I feel like we're going to have some type of, I feel like this is going to continue on because there's such a disconnect between men and women. But if y'all feel differently, you can let me know in the comments below. So, all right, man. I know I've kind of talked about a few things that really I feel like need to be addressed. But let me give y'all some positivity. All my nurse friends out here, and then maybe if you're not a nurse friend, and maybe you're just somebody who's just, maybe you're new to healthcare, maybe not. I got something for you. So I'm trying to get better at leaving you guys with something, especially on a positive note. So according to, looks like Angela Walker, the best shoes for nurses in 2025. Now, when I say nurses, they're on their, they're on their feet a lot. And so if you're somebody who's in a career field, you're on your feet a lot and you want more comfortable shoes, well, according to this, maybe we can kind of give you some tips, right? And here's what the criteria is based upon. Before I read the list, here's the criteria. The criteria is quality, cost, comfort, water resistant, sharps resistant, non-slip, style / fashion, foot / ankle support, durability, and the ability to clean. So that's the criteria. Okay. So let's read this list. I came up with 12 shoes. And I can already tell I have not worn all these shoes, so I can't give you, an unbiased opinion, but I've worn a couple of these. So we got Clove. That's the number one shoe. I'm just going to go from 1 to 12. Clove, Stand Plus Shoes, formerly Gales. We have Uni Shoes. We have Figs. We have Asics. I've worn Asics. I got a pair. Not bad. Not a bad shoe at all. Brooks running shoes. Yeah, I'm gonna leave that there. Nike Vapor Max. I haven't worn the Vapor Max, but I've worn of course I got Nikes. Nike's definitely my number one brand for sure. Hoka. I have one pair of Hokas, but they're for running only. I don't have Hokas for nursing, but just running. Let's see. Algeria Women. Okay. On Cloud running shoes. Vessi and Dansko nursing clogs. That's the one thing you will not find me in. It's clogs. So you ain't got to worry about seeing Wakanda in clogs. That's not happening. But those are the quote unquote best nursing shoes. So if you're interested in any of those, you need some workplace shoe suggestions. There you go. So you got Clove, Stand, and Uni. They're the top 3. I mean, personally, I'm biased towards Asics and Nikes because that's what I got. So I got those. So if you kind of want those, I mean, there you go. All right. So if you guys like this type of content, let me know. This is mono y mono Wakanda. This is solo dolo Wakanda. So if you like this solo dolo stuff, let me know. I'll do more of it. Because I love to have guests, but every now and then you'll see me come out here and talk about a variety of subjects too. So thank you. Thank you for spending time with me, your friendly Wakanda RN. And I love you guys. I hope you guys have a blessed rest of your day. And until next time, so make sure you follow me. Make sure you like the content. Give me a follow, like, subscribe, donate if you feel like it. And so anyway, love you guys. Out.